So feel free to share this if you want. But yeah, I'd love to have this too, just so I have a record
Yeah,
of
of
it.
course.
I find Zoom is a great way to do scholarly presentations for future reference. So yeah, this is the Active Living Trails project, and it was a dot agency project working with community partners in Wyandotte County, as I mentioned earlier to you, Minnie, and it's a partially funded through the Gehl Institute, which is where it was presented. And so dot agency is a part of the KU School of Architecture. It includes Shannon, Chris, Niels Gore, and myself. And Shannon and Niels are tenured professors. I'm a PhD candidate wrapping up my PhD, and I now work for Children's Mercy Hospital. But dot agency is kind of this informal thing. We created it sort of out of thin air based on this idea of spatial agency. I think I mentioned to you before, but it's that architecture and design can be more of a collaborative approach and a process. And we were responding to things like what we had seen in urban planning. So, you know, the Model Cities program, if you look at what Sherry Arnstein, an urban planner, talked about, it was that the process of improving communities has historically always kept them away from the decision-making table, that people are being planned for and not with. And so that's kind of a driving force in the work we do. And there's also a lot of architects who talk about this work. A famous club of architects was Team 10 in the theory of modern architecture history. And one of them, an Italian architect, Giancarlo De Carlo, basically said, it's too important to leave it to architects. And so we really believe in like working with communities. And so in Wyandotte County, Kansas, more than half the population lives in an area that's about 12% of the overall geography of Wyandotte County. And so it's a consolidated county government structure. The city of KCK is that eastern, third of the map with 86,000 people. But the whole county and cities in that county merged under one structure called the Unified Government of Wyandotte County a few years ago, about 25 years ago. And so it's an interesting model of it's almost like a microcosm of the country. It's also one of the most diverse counties in the country. So these maps came from the Wyandotte Heat Report, but you have predominantly white population on the western half of the county. You have pockets of Black, non-Hispanic communities, especially in the northeast part of the community. There's a first and third wave immigration that's happened in the Hispanic population along Central Avenue and in the Armourdale and Rosedale neighborhoods and Argentine neighborhoods. And Asian populations actually increased a lot, partially because of there's been refugee resettlement, and the Nepali and Burmese community members have moved into the community. And the Robert Wood Johnson Foundation came out in 2012 with the county health rankings and ranked Wyandotte County last, basically. And this triggered a whole wave of public health initiatives in Wyandotte County, basically saying, we have these mental health and physical health and behavioral health issues. How are we going to respond? And so they took a kind of a collective impact approach, and that's called Healthy Communities Wyandotte. And we kind of came along later with that agency because we were seeing them talk about the social determinants of health. But the built environment obviously is a part of that, and yet they weren't really, they had an infrastructure action team, but architects and planners weren't showing up to these meetings. There was no interest among architects and planners to talk about the built environment as it relates to health. It's part of the way our profession's set up. We're not very good at doing community social impact work. And so one of the things we started doing is working with our community partners to understand the spatial distribution of health. We looked at rates of poverty, where park access was, and life expectancy. And so I mentioned these maps earlier. All of this mapping work was done by the Kerwin Institute, by the way. It's not ours. But you can see that in areas where active living trails were, which are right in this area, the average life expectancy in Turtle Hill neighborhood is about 59 years compared to the 76 years out in Piper neighborhood, which is mostly kind of a rural suburban environment. And so the disparity in life expectancy tracks with the disparity in kind of proximity to park space, and there's a lot of evidence behind this relationship, and also in terms of poverty, which is kind of the underlying factor here. This is a study we had looked at that showed that even when you control for income, access to parks can improve public health outcomes. It can improve rates of physical activity. Even when you control for poverty, just having more access to green space is what they studied. we looked at that as an opportunity to map out where parks were. And there's 54 parks in Wyandotte County. And we looked at the trail of Jersey Creek. And within a half-mile distance, a walking distance of the 5 parks along the Jersey Creek Trail, there's 23,000 people. If you go out west, there's a kind of a regional park called Wyandotte County Park. Within a half mile is 300 people. Now, granted, lots of people drive there, but Wyandotte County Park and Wyandotte County Lake get millions of dollars of investment from the city because they're regional parks. And yet, when 23,000 residents live within a half mile, it gets very little investment. And so our kind of argument in this, the systemic argument, is that there's been a disinvestment in areas where most of its residents live, and we should consider improving access to and the use of the parks in areas where more people can benefit on a daily basis, especially those who are maybe most at risk of chronic disease and most dependent upon walkability within their immediate surroundings for their physical health. And so there was a lot of organizing that came out of the Healthy Communities Wyandotte. One of the things that they called for was initiative to work together, because each of these kind of separate groups that would show up to these meetings, they wanted to build a coalition that would say, look, we know we have this issue east of Wyandotte County. We're separated by rivers and highways sometimes, and languages sometimes, but we have the same issues in the built environment. And so we mapped out a healthy community corridor. This is one of the first maps I drew for Dot Agency, and it looked at this new bike lane that we were getting along our 10th and 12th Street. And we, saw it as it was being installed, and we submitted that everybody that could get to that bike lane or the parks in that area would be enough to kind of have an impact on the health disparities of Wyandotte County. And so we did that because there was a project called the Healthiest Cities and Counties Challenge, and Aetna required that you meet a certain threshold of population density for you to be in the tier 1 category and receive grant funding for your project. And so we drew it intentionally to include more than the minimum number. And I think we had to clear 65,000 people. And within this corridor along the bike lane, it was 84,000. And so that was kind of our intent, is let's connect people to parks. And so I mentioned this to you earlier, Minnie, but we did a whole, iterative process of designing with neighborhood partners and leaders to take a park bench, which the CDC said was sedentary behavior, and turn it into a fitness trail station that could be used by our community partners, because that's what the CDC would fund. They wouldn't fund sedentary behavior, they'd fund community health. We have other projects that are related to this along the same healthy community corridor. We saw access to our levee trails. This just got a major grant. It's up for a major grant from our Mid-America Regional Council, MPO. But we knew that trail finding is a challenge when these things are kind of buried in industrial neighborhoods. And so we've advocated for increased access by opening up the levee road. A lot of partners have done a lot more work than just us on this, but we designed and built signage that prominently displays where the levee trail is. And then we worked with partners to organize community events where we'd program the trail and get feedback, which later turned into future grant projects that the city now pushes for. We organized walking clubs through community mobilizers in English and Spanish, text-based services. These are no longer continuing in every neighborhood park, but a few of them I think still might be operational. We had a whole text message service set up under the 1422 grant, and we did things like walk with a doctor. This is some of the stuff that eventually led into the active living trails, was a signage system. We had an architecture student who said, I was in Italy and every neighborhood had these community totems, and a community partner said, I would love one. Can you give me a better prototype? She did this with $200 at Home Depot. We used some tools at our architecture, design build warehouse to prototype one of these trail stations. And then we worked with a graphic designer to finalize what they look like, and they promote the neighborhood and the community resources. And so our approach, this is some of the folks that worked with the Kansas Department of Health and Environment and our public health partners at the Community Health Council, was to really make the argument that better design can improve placement and promotion of access to public health in the built environment. And for this project, our question was, do these improvements actually encourage physical activity perceptions of access to health and public space. That was kind of our big idea. So we worked with community partners. Broderick Crawford has become kind of a national leader in health equity movements, as well as public health department, a neighborhood resident who's a walking community mobilizer, and our Parks and Rec department friends. We used the Gehl Institute's survey tools. We collected data. We looked at how we were going to kind of map where people were crossing certain checkpoints. It wasn't the most effective use of data collection, but it was what we had available and what was provided to us with some of the grant funding we had. And so we were really trying to say is before and after the intervention, did we see an increase in physical activity and changes in perceptions? One of the features in the park is a spray park. One thing we noticed was the signage was really kind of dilapidated, things that would basically kind of tell you to stay away. It's not a friendly environment, despite the fact that there's so many kids playing here. But this one sign actually made a little bit of sense because at least balloons clog the water filters. So no balloons make sense, but the rest of them kind of bring this kind of oppressive feeling of you don't belong, you're not welcome. This sign was meant for a boat loading dock, and they wiped out part of it that says bank fishing, just so it could be applied in this park, which made no sense. And it was turned away from where most people were using the park. So again, it's almost like this, it's a sense of negativity that the signs projected a message of you're not welcome. And so one of the things that we did that was not a part of the grant, but I implemented, was this sort of participatory mapping translation process for how we could design these parks. And so we took the Gehl Institute, they're now closed, but they were developed by Jan Gehl, who's an urban designer, and these were his 12 principles of good urban quality. And it's kind of, it's sort of somewhere between evidence-based and just design jargon. But I took each one of these and I simplified them and put them on a button. And the button was magnetized in the back. And we brought out these big tables that had a magnetized metal surface. And we laid the maps out. We used Google Earth to print really large maps. And we used the buttons to let anybody who was in the park that day during our observations tell us where they wanted to see improvements. And so they were telling us stories about the park that no survey tool, no logic model would have predicted. We actually got really great feedback from residents and from kids. We made it a game. So the kids that would come through, they were asking us, well, what does this mean? What does that mean? And we basically said, you're an architect for today. Design a better park. Where would you want to sit? Where would you want to play? We heard stories about areas where there was heavy brush that was too close to a playground. And so mothers would not let their kids go to the playground. We learned that areas that were not accessible were dangerous because there was either gravel or needles in the area that just didn't feel safe. There was lack of connectivity in areas from the parking lot to the park. There was a consent decree that this area required ADA curb cuts, but did not require sidewalks. And so there's this whole issue of environmental justice that this project can't even address. We use it frequently as an example of, this is problematic. We should do something about it. We're going to continue to advocate for it. But with a few $1,000s, that doesn't get you more than a couple of inches of sidewalk by the time it's all done. We saw things like the signage be dilapidated. Again, just doesn't make it feel like people are cared about. And that's kind of the whole crux of the active living trails, is that you need to be caring about folks and really giving them the tools to take part. These park benches were dilapidated. It's not going to be in the slideshow, but we've since restored these with our friends at YouthBuild. We'll talk about later, but these are now in great condition, and we're excited about that because that'll probably outlast a lot of the other features of this project. But we also saw stuff like sodium hypochlorite barrels that had been sitting there apparently for months, and we took a photograph and sent it to our friends at Parks and Rec, and they got them removed. This is like illegal environmental hazards being dumped in the park near kids playing. But it's not all from, bad actors. The city itself is under a consent decree because our trail itself is along a creek that's a combined sewer overflow. So when there's heavy rainstorms, this area fills with sewage. And so it's a potential water, airborne hazard for kids in and around the park. And so we're continually, to this day, having monthly meetings with our parks, our public works, and our local Mid-America Regional Council, MPO, to advocate for them to do better and address these issues so that kids are not playing in and around an open sewer at times. At the same time, the park's heavily used. Like we saw when we, I would argue anytime you do a built environment intervention related to public health, you really need to spend time there. And this project taught me that. We got to be around kids using the park trail for their weekly cross-country running practices. And, the trail was heavily used. But we did see them get lost a number of times because the signage wasn't great. And so we also looked at Heathwood Park. There was a park shelter, an old public works project bridge. There's the only public pool in the community, Parkwood Park Pool, but we saw the same stuff. We saw signage that told people to stay away. We saw signage that was, riddled with bullet holes and dilapidated. And we brought out the same process because we wanted to kind of do this sort of comparison with the parks. This is Dorothy McField, James McField, Carla McField, and one of their neighbors, but they were 4 of the members of the Parkwood Neighborhood Colony Association. So they were telling us stories too about how great this park used to be. And we've continued to work with them and other neighborhood leaders in and around this area. But they said, there's such a beautiful view that people don't know about the history, and we don't have lighting and we don't have access. There was also this long-seated desire to do work that's been asked about for decades. This gentleman brought a list of something that never got built that they thought that was going to get built 10 years ago. And so one of the things they wanted to see was a connective tissue between the pool and the trail. That's the closest you can get from the pool to the trail right there. And you can see it takes going down a hill, and there's no real access point from one to the other. We also realized that the community had other issues going on. So a public restroom, at one point, somebody made the decision that, security is a bigger issue than people's welfare and well-being. So we're going to take the doors off the stalls. And lighting was an issue. There's no public lights in the park shelter. But what we observed was the demographics of the community. Even if you look at a map, you'd say that this community is 83%, I think, African American. But that doesn't represent who actually uses space, public space. And so, again, be present, get to know your community, be a part of it, be there. And what we learned was that the parks was used by a very diverse population, including many Spanish-speaking residents who turned it into an informal birthday party. And so I became their photographer and sent them these photos for the day, and they gave me permission to take these photos and share them. But these were photos of the birthday party, and seeing the vitality of the park. It just doesn't make sense that you put bathroom stalls that you take the doors off when there's kids' birthdays parties trying to use the area. And so we took the maps that the community had proposed and actually translated all of that, with those magnetic buttons onto small tactical interventions that we had enough money for to change the signage, to create connectivity, and to kind of lift up the concerns that the community talked about with what little resources we had. We worked with YouthBuild, a local Department of Labor funded construction trade apprenticeship program. They get youth 16 to 24 to come through. They get their GEDs, and they get certified training in construction. So Spark, this is their leader, with my colleague Niels in the baseball cap. And Spark and Niels are kind of design build guys. They build stuff for a living. And so eventually Spark replaced these benches. I don't have photographs of that, but the trainees were awesome. We did a septet cleanup with the trainees and community leaders. This is Broderick Crawford, making sure the trail was clean, picking up trash. One of the funnier things that a trainee said was, the trail was cleaner than their bedroom. But also realizing that issues like public health, like CSOs, this stuff doesn't translate. I did a different project related to Jersey Creek Trail with kids after this. And one of the things we learned is that when a basketball rolls down the trail into the creek, it's going to collect contaminants and potential raw sewage, dangerous, toxic stuff. nobody knows that that's problematic. They just think of it as a creek. And so we have this open sewer that, yeah, we put up signs warning people, but this stuff doesn't often get followed by children who can't even read it sometimes because it's either too high up in the air or it's using very technical language that I think there's a need for translation in public health in our built environment, and especially as it comes to environmental justice issues. We saw oil stacks. This area is all zoned industrial, even though it's considered a park. So we've never made, proper access or the proximity of public health and zoning an issue before. And it's starting to change now. These oil stacks are now gone. But this area is still probably close to what you consider a brownfield site based on its use. And yet it's where we expect people to go and be physically active in a predominantly low income community. So what we're talking about is sort of an environmental apartheid. We have allowed for industrial toxic use to be adjacent to where people are expected to be healthy. And I think that's something that people in public health and in architecture and planning need to be better about going forward. And we don't talk about these issues enough because we're usually never in the neighborhoods to actually learn about it from the perspective of the residents who live there. A lot of what we did for the Active Living Trail, we learned from other programs. We Are Moose, I think out of Ohio, and Tiny WPA out of Philadelphia are two programs that do a lot of YouthBuild type programming, training, construction, things that are fun and simple to build and easy. So we took those approaches. I used, design software, SketchUp, Lumion to design similar prototypes and then handed those off to YouthBuild. They built them like they would build a roof or a wall section or anything else that would be helpful for their trainees to build. They painted them bright colors. They got paid to do the work. They got to install them. You can see our architecture installing our signage the same week that we installed the park benches. We were told with these park benches, I mentioned to you, Minnie, earlier, that these would be stolen. So the trainees built them so freaking big that they would never be able to be moved without this many people. And they're still there to this day. A big thing we did was connect our local leaders like Broderick to programs like YouthBuild. So where our trainees and our neighborhood leaders now know each other. The program, Active Living Trails, was one of the first programs where we were actually building these relationships that continue to persist and build up the strength of the community to this day, where they're going after grants and other projects. I mentioned to you earlier, Minnie, Broderick's church just hired YouthBuild and Spark to build a stage for their church to have physically distant outdoor services during COVID. And so this was the first time they met. And so it's these types of relationships and this kind of generational learning that doesn't get measured in projects like this, but I think it's just as powerful. So my role was to kind of design, because our Parks and Rec department, I mentioned this to you earlier, wouldn't let us do permanent installations. There's this whole concern about liability. So we did temporary. And so what you see is like the architectural view of how do we make these things not fall over, not get broken. Unfortunately, a lot of this stuff has been damaged beyond disrepair. I'd say about 2/3 of the signs we put up have been either broken or vandalized in some way. But we put them up in English initially and in Spanish because of our observations. The designs were done partially because of what we saw, what our community, engagement process told us about, trying to create a language that was just friendly and welcoming, enjoy the trail, all the stuff that says no, stay away. We wanted to respond to that. We also used, I think the Mayo Clinic or Johns Hopkins had, some information on type 2 diabetes that was easy to communicate. So we borrowed from that. And all of this signage went up in tactical locations based on viewing angles and kind of things like that. So you can see the seesaws in the background and telling people, please keep the park clean, in English and Spanish in areas that people could see very clearly on, long angles. So it drew their attention. We hired community mobilizers, residents of the area, to do the observations before and after the installation so that they were paid to be a part of the process. And then even the installations kind of became an event. We promoted our community partners. This is now an organization known as Groundwork NRG. They're a part of the Environmental Protection Agency, Groundwork USA Trust. So they've evolved partially because of projects like this. And so you see how just putting up a sign can get people excited about what's going on because it's new. Uh, we installed these lights thinking that they would, help for a little while. They were stolen within a week. So not everything worked out the way we wanted it to, but, it was for a moment something that you could say, wow, that's a little bit more friendly than what it had previously been. We did additional kind of graphics and just using what we could, just a little bit of paint to create an environment of physical activity and hopefully make people feel more welcome. And so you see a lot of photographs. I think important thing is to document the work. And I think it's also important to make it fun. And so we, told stories about these projects with neighborhood leaders. We shared them. Our friends at YouthBuild were able to mulch an entire trail. We didn't even plan for that. We didn't think we could afford it. And they just went out and did it. They had a connection. So that connection from the trail, I don't think that's any, I think this has kind of been washed away. But this is the type of what would it take just to make people feel like they're being listened to, and hopefully this investment sparks a conversation that sparks long-term work. And so along the Jersey Creek Trail, this is where the Jersey Creek Trail is near Heathwood Park. The sign's been broken down and the trail's still pretty beat up, but it's probably going to get 2 separate $150,000 grants in the next year, partially because of the momentum that we were helping build up at this time to celebrate how great this trail could be if it was used. And so bringing this back to architecture, the presentation was for an architecture school at the time. We were bringing our friends at YouthBuild to learn from Mario Gooden, who's one of the leaders in the country on, and really in the world on, as a Black architect. And so trying to build pipeline and connections, we've done a project called the Project Pipeline KC with Brian Lee from the National Organization of Minority Architects, who's a friend, and he's working on design as protest now. So it's about increasing diversity in the field and in academia. And so trying to make these connections between our community partners and some of the national leaders in these movements. So it's been a informed way for us to be more responsive to our community, but we also learned something along the way at the Active Living Trails. And it's been a while, so I looked at these slides, so forgive me if I have to reread them, but I do remember that we asked just point blank, would you use the trail more? And we did it before and after the signs and the park benches and all the little details that I've shared. And people seemed to be more positive. Obviously, there might be some bias. The questions were not validated. None of this was done with an IRB. It's not been published as research anywhere. It's really a design project with the Gehl Institute tools, which they're no longer around. That said, you can see that there's a discrepancy just being, before and after. We saw more people being more likely to use the park for physical activity. Thinking that more people loved the park for physical activity, and people felt safer because of the improvements that were made, because they felt like somebody cared about the park. And this was kind of the biggest question that we asked early on. We said, do you notice the signs in the park benches that do you notice them and do you appreciate them? And before, people said no, maybe, yes. And afterwards, a lot more people noticed the changes to the built environment. And in encouraging, our question was, does that encourage perceptions of public space? I'll be honest, this was early in my PhD. I wish I would have been more strategic about making this the topic of a dissertation and a study. But I think that this is a good example that changing the built environment, having community participation in that process, there's more to learn. There's further insights, I think, for public health and architecture and urban planning to work together. And I think that there's a lot of storytelling that goes into that. So if you check out the Active Living Trails project on Dot Agency's website, there's this great video. We didn't plan for it, but the qualitative aspect of this study was a 1-minute interview I did. I just sat down, did not plan for it. I turned the camera on and hit record just in time to hear a resident share her story about seeing the signage and how she said that it's going to help her be more active in the park because her doctor told her A1C levels were high, and she was riding by and she saw a sign that says, use the park for physical activity to reduce type 2 diabetes. And she said, okay, now I'm going to be coming back to the park. And so those types of stories, I think, have impact beyond the life cycle of this project. So that's all I got.